The NHS is 75 years old, but we're working it harder than ever. It's struggling. The government says reinforcements are on their way.
I'm really looking forward to finishing my course and then using all these skills that I've learned to really make a difference.
Every day I come home thinking just what a great privilege the job is.
I felt like I wanted to give something back, so that's how I've ended up in the NHS.
But also some time for us.
The Prime Minister was at a hospital in Cambridge this morning. He says he will revive the NHS in England by fixing the critical shortage of staff.
Thank you so much. Well done.
It just isn't right that we don't train enough people here at home to properly staff our National Health Service. We'll double the number of medical training places by 2031, focusing on areas where there are too few doctors today. We'll train over 24,000 more nurses and midwives a year and increase the number of GP training places by 50%.
The number of unfilled posts has soared since 2010 and now stands at 112,000. That's 1 in 10 jobs. The government says by training more staff and hanging on to more of those it's got, by 2036-7, the NHS in England could have 170,000 extra nurses, 60,000 more doctors, and 71,000 more health professionals like paramedics, physios and radiographers. Many of those will be apprentices who'll train on the job. Steffi Ward is earning while she studies mental health nursing with the University of Derby.
I have children, I have family that I still need to support as I'm going through the training. So that's why I chose the apprenticeship route, to gain that hands-on experience and that solid academic foundation at the same time.
Today's workforce plan talks about a fifth of future staff coming out of apprenticeships. Derby University cautions such courses are not simple or cheap to do well.
Universities need support to be able to increase the number of apprenticeships. And if what's in the workforce plan is to be realised, that has to be structured, it has to be invested in.
The Doctors' Union, the BMA, says consultants could struggle to train apprentice doctors because they're so overstretched. One of the reasons, along with pay, that consultants and junior doctors will go on strike next month.
Shouldn't doctors going on strike look at today and think, well, the government is making a sincere effort to ease the pressure on us and on the NHS and therefore not strike?
Well, I mean, it's very interesting because the report opens to acknowledge that hard-working staff are the bedrock of the NHS. And that's not what it feels like at this point in time. So you need to be able to value the doctors that you've got already. They have seen their pay fall in real terms by 20, 30%. And unless we do value doctors now, why would anyone come into the profession in the future? So getting both ends of this equation right are hugely important for the future of the health service.
Patient satisfaction with the NHS is the lowest it's ever been. Staff satisfaction too, it seems.
Many have been on strike and many have just gone. Tens of thousands of nurses quit last year and almost 10,000 doctors gave up their licences to practice. Unless the NHS can improve retention, a big recruitment drive may just be like trying to fill a very leaky bucket.
Labour said the Conservatives are to blame for an NHS in crisis and are now stealing its ideas.
Well, Labour's been calling on the government to double the number of medical school places as part of our plan for the biggest expansion of NHS staff in history. And it looks like the Conservatives have looked to Labour for the answers. I hope the country will do that at the next general election too.
On all sides, there is relief to finally see a workforce plan for the NHS in England. But with the current ills, 7 million patients waiting and more strikes planned, things could feel worse before they get better.
Well, joining me now to discuss the workforce plan is the Conservative chairman of the Commons Health Select Committee, Steve Bryan MP, Dame Helen Stokes-Lampard, a GP who chairs the Academy of Medical Royal Colleges, and Sean Charlwood from the British Dental Association. Steve Bryan, first of all, I mean, we see Rishi Sunak saying it shouldn't be like this, as if he's just walked into the room and found himself in a situation he had nothing to do with. shouldn't today have been accompanied by some source of acknowledgement or apology for getting it in this mess?
Well, yes, of course, if nothing had happened between now and when we took office in 2010. So there was a 25% increase in training places in 2018 when Jeremy Hunt and I were at the Department of Health. Today is the latest part of that, and it shouldn't be seen in isolation. Today's workforce plan is a long-term work. There's a clue in the name, a long-term workforce plan. It certainly won't talk about short-term industrial disputes, and it's not a short-term plan. When the government does short-term eye-catching measures, you in the media quite rightly call it out for doing short-term thinking. This is long-term thinking, and I choose to be positive and half full about today's announcement. And I think 40 different organisations putting out positive, supportive messages about this today. And the fact the Labour Party, the best they've got is to say, well, they nicked our idea, I think is actually credit to the government. And it's very easy to be cynical. And I lead a cross-party committee, and we will look with great detail and scrutinise this report. But actually, it is long awaited, but it's also landmark. And I think we will look back on today as a really important moment for the NHS. It's a big moment for it. It's a good day for the NHS and for patients.
But it is also very politically convenient, isn't it? I mean, it's not sort of selfless long-term thinking in that it enables the government to now, every time it's sort of faced with criticism of the state of the NHS and the shortage of staff, of saying, well, look, we've got a long-term workforce plan and we're going to double the number of training places and we're going to double the number of doctors. It's an easy answer for some sort of jam tomorrow that we may or may not ever see.
Wow. Well, if I may say, that is incredibly cynical. Look, even if this government has a full historic fifth term, many of these doctors and nurses that are in this plan will not be trained by the end of that term.
Yeah.
So you know, the governments have to think long term. They have to think about the future when they may or may not be in office. And you know, we on the Select Committee are really pleased, actually, because we produced the workforce plan when Jeremy Hunt was chair of that. And over half of our recommendations have come through in today's plan. And some of it will be controversial around the length of medical degrees, which I'm sure you may wish to come on to. But actually, the fact that there is now a plan, I think that gives great hope. And I think that should give great hope and encouragement to those that are stuck in industrial dispute right now.
Let me bring in Helen Stokes-Lampard. Do you see the evidence in this plan, given the number of vacancies there are in the NHS, that these places will be filled and that we will get the number of doctors into the health service and that they won't just be trained and then emigrate to Australia or anywhere else?
This plan is quite a remarkable moment in time. And what's fascinating is that despite all the negativity, despite the waiting lists and all the rhetoric we see, there are thousands of phenomenally bright, talented young people who still desperately want to train to be doctors, to be nurses, to be dentists, and to be the whole plethora of healthcare professions that we have. So the expansion that's being discussed, I'm very confident that there are brilliant young people who will want to take up the opportunity to train. There'll also be people who want to change direction, and the apprentice route may suit people who are already in jobs, got degrees of other types, who will want to retrain. So, yeah, that's actually the least of my worries about implementation of this plan.
Okay, what's your biggest?
I think the biggest challenges ahead are exactly as was alluded to earlier. We have the backlog, we have a huge pressure to deliver in the NHS right now, and to train people and to do it well takes time and it takes money. And people having the headspace to train others well is a difficult balancing act. But the NHS in England, the staff within it are absolutely ready for that challenge, because what people can see, people love to see hope. And if they get hope, that gives them a renewed energy to do that little bit more, to train and teach others. And as somebody who has worked with younger doctors and younger nurses over time, it's the most energizing and positive and rewarding thing you can do is to teach others. So I would urge people to take this as the good intent that it's there. Let's hold people to account, whether that's our politicians or NHS England senior leaders, to make sure that we deliver on these in the timescales that are being suggested, because quite a lot of this is to be started within the first 5 years. The 2.4 billion is committed in the first 5 years. I want to see the colour of that money in the system swiftly.
Let me bring in Sean Charwood from the British Dental Association. We saw the Prime Minister today saying, you know, they're looking at the problem that we have of sort of not being able to find NHS dentists, and are looking at tying newly qualified dentists into a commitment to treat NHS patients. And we've already seen dentists complaining about that. Why? I mean, it seems pretty reasonable to most people, doesn't it? If we pay for the training, that we should actually be able to get a dentist.
Yeah, I think fundamentally, though, Christian, we need to make the NHS dental service an attractive place for young dentists and dentists generally to build a career, instead of effectively handcuffing young dentists to what feels like the sinking NHS dental ship. We used to have a situation where people happily worked in the NHS, they wanted to work in it, and they weren't handcuffed in order to do that. People had a contract, they had conditions, the NHS dental system was funded and remunerated correctly and sustainably, and people wanted to work in it. And we've long advocated this fully funded workforce plan for NHS dentistry, but we can't recruit our way out of a retention crisis without addressing the factors that are pushing dentists out of the NHS at the moment. It does effectively feel like we're trying to fill a leaking bucket. And we may have more dentists in 7 years' time, but there's no detail on how we are going to halt the exodus of dentists from NHS dentistry that millions of your viewers will be experiencing right now. And, you know, action in years' time, I understand the benefit of a long-term plan, but we really must have a short-term urgent solution to the issues that are being faced by dentists and patients right now.
Steve Bryan, I mean, like a lot of things, it does also come down to the amount of money going in to health. Now, we saw the former Health Secretary, Matt Hancock, this week at the COVID inquiry saying Britain needs to have a big conversation about whether it is prepared to spend more as a share of national income on health like other developed nations. Why aren't we pushing that as a big conversation and a big debate?
I mean, the NHS, when it comes to talk about NHS funding, the NHS in England has never had more money. I think it's gone up by nearly 40% in real terms since we came to office. I mean, you know, when Jeremy Hunt and I were at the department, you know, it went up by nearly £20 billion. So the conversation, sure, we can have a conversation about how much more it should have, and then of course we have to decide how we're going to pay for that. But look, the wider point here is that, you know, when you talk about dentists, I wouldn't use the expression handcuffing dentists to the NHS, but I think my constituents and your viewers don't think it is unreasonable that if the British taxpayer spends what is a lot of money training clinical professionals, that they should work certainly for a period of time in the NHS. I hear that from constituents all the time. But look, the wider point here is that we are spending a lot of money on health, but demand is outstripping supply. And the view that I would take, and Dr. Stokes-Lampard and I discuss this on our podcast all the time, is that if we don't get serious in this country about prevention of ill health, then we will continue to see demand outstrip supply.
Okay.
So that's about our obesity challenge, our diabetes challenge, and we will never have enough staff.
Let me just
briefly, never have enough money if we don't get on top of that.
Just last word to Dame Helen. We've seen some doctors also raising concerns about patient safety with the new training regime, that doctors are going to be brought in, student doctors are going to be brought in earlier, we're going to have apprentices. Are you worried about any of that?
I'm considerably less worried about it now than I was 18 months ago when we first started talking about these things. These are exactly the concerns that the Academy of Medical Royal Colleges raised with the General Medical Council, with what was then Health Education England and others. And we've had all the assurances every medical degree apprentice will go through the same rigorous standards and quality assessment that all doctors will. So a doctor trained by an apprentice route will be the same as a doctor trained by a traditional university route when it comes to the output at the end. The training route will be different, but the degree and the qualification and the quality of the doctor you will get will be the same.
Thank you all very much indeed for your time. Thanks.
Thanks.